Hi, YouTubers. Something important, something kind of damn important. So today's directly to the big ass right now. So directly to this right now. So talking about this right now. Essentially, obviously, no perfect chill the last damn time because the bullshit. So bullshit is bullshit. So anyway, talking about base right now. Essentially, pipe and cigar smoking and lung cancer CT screening. So basically, this is a health-related subject. So if you're not into watching health-related subjects, please click off right now. No nasty comments like the big ass cigar. This is a health-related subject. So anyway, the question we're going to answer is it really worth somebody's time who's a pipe or cigar smoker, tobacco pipe or tobacco cigar smoker, to get a low-dose CT scan for lung cancer? Now, most people know they do low-dose CT scans for cigarette smokers. People who are cigarette smokers, they do starting around age 55 if you're in a high-risk group. Basically, I'm not a doctor, obviously not a fucking doctor, but basically they do a low-dose CT scan every couple of years just to see if there's any evidence of lung cancer, because that's considered to be a high-risk population, people over the age of 55 who have a significant smoking history. So and that's cigarette smokers, obviously. And obviously, I don't smoke cigarettes. I haven't touched a cigarette, and I mean, God, like 10 years, so almost 10 years, I haven't even touched a cigarette. So my question is, for pipe and cigar smokers, because we don't inhale, or most people who smoke cigars and pipes don't inhale, the majority of them just puff on the smoke, would it still be worth your time to have or would you even qualify for a low-dose CT scan for lung cancer? Like, would your insurance even pay for it? Now, I'm not sure about, your guys' insurance, I'm not sure how I would feel. So it's kind of a interesting subject because obviously pipe and cigar smoke is not meant to be inhaled. It's just meant to be puffed on, and you're not directly inhaling. Some people retrohale, which is exhaling through your nose, but most of us who smoke cigars and pipes don't, inhale because you cough your fucking brains out. It's like, so you'd probably be at much lower risk for, naturally for lung cancer. You're more at risk for oral cancer and esophageal cancer and like tongue cancer. But you're less at risk for like lung cancer, obviously not glorifying in any way, shape, or form. But yeah, it's like, would you even qualify? I don't think you would. I'm not obviously not a doctor, you're not a fucking doctor, but it's like, I don't think you would even qualify, because in order to be qualified for this under your insurance, you have to be a cigarette smoker, and you have to have what's called a 15-pack year history, which is either a pack a day for whatever years, a pack a day for 30 years, 2 packs a day for 15 years, or 3 packs a day for 10 years. I'm not even sure if your insurance would pay for it if you were like a cigar smoker, like having like 1 cigar a week. And probably, and I'm not trying to glorify in any way, shape, or form tobacco use, because that's obviously against YouTube's ad-friendly guidelines. I'm not even sure if it really would be worth your time, because if you're only having like one or 2 cigars a month, it probably wouldn't be worth your time. I mean, because the amount of damage you're doing. I mean, I'm not obviously not a doctor. I'm not a fucking scientist. It's like, but I don't think it would be in the same ballpark as somebody who's smoking, 2.5 packs a day. Because you have to consider, and I know this is a little bit of a long video, but you have to consider when somebody's smoking 2.5 packs a day or 2 packs a day, they're doing a tremendous damage to their lungs. Like they're, dramatically, affecting their lungs. Significant amount of damage. Tremendous amount of damage to their respiratory system and their cardiovascular system, like 40, 50, 60 cigarettes a day. And somebody like me who only smokes one time a day, maybe twice a day, I mean, yeah, I wake up and I cough a little bit, but that's just because you're a smoker. It's like, everybody who's a smoker coughs. It's like, anybody who's a cigar smoker, cigarette smoker, pipe smoker, or pot smoker, every now and then coughs. It's like, I'm not really sure. This is a very interesting subject, so I would have to do more research on it. would your insurance even pay for it? Because without insurance, it could easily be a couple $100 every time you have a scan. So, yeah, I'm not really sure. Would your insurance pay for a pipe and cigar smoker, tobacco pipe, tobacco cigar smoker, not marijuana smoker? Would your insurance even pay for a pipe and cigar smoker to get a low-dose CT scan for lung cancer every, like, 3 to 5 years? Anyway, I have no freaking clue. No fucking clue. Bye. Big ass cigar for life.